I think that every solution for healthcare that's not single payer systems is bad.
That's the odds. Just there's no way, there are no marginal improvements. There's nothing you can do to make things better. It's an all or nothing of the most extreme solution you can think of, or it's just okay.
Every solution that necessitates insurance is bad.
Keep in mind, places like Canada, in most countries, you can buy separate insurance, but okay.
It's like the window in which we're looking at solutions to healthcare is too small. And it's always been like this. Luigi Milkes. Yeah, I'm just saying you should shoot the people that run the services, but I don't agree with it. Yeah.
And he became a hero to the left. Let me tell you, if we find something better, I would love to do it. But unless we find, but one thing I have to say, I inherited Obamacare or anything else you want to go. It's got about 20 names, but I inherited it. And I had a decision to make with Health and Human Services. I had a big decision to make. Do I make it as good as we can make it, or do I let it rot?
Yeah, exactly. Can you explain single payer for normies?
Yeah, exactly. Wait, what did Trump do? We're just playing, this is just a Trump propaganda channel? Holy fuck, somebody in the chat said it, you're right. He's just the Hassan for the right, I guess. Oh my God. It's the monkey paw, right? I understand the monkey paw meme now. Like 2 months ago, I was like, I just wish that there was pushback against Hassan on Twitch. And this is it. It's the right-wing populist pushback.
Basically, your taxes are higher and the government gives you health care. That's what I think the solution is. Because so think about it like this.
That's what single payer is. That's what it means.
Single payer for...
As we can make it, or do I let it rot?
Yeah, exactly. Can you explain single payer for normies? Basically, your taxes are higher and the government gives you health care. Okay. That's what I think the solution is. Okay, because true. So think about it like this. Every dollar spent on healthcare that goes to a private company, a lot of that money is paid out in dividends and big CEO salaries and payouts to other people. So there's a lot of excess money that the company collects because it's a for-profit company. All of that excess money is being added to the total amount of healthcare cost an individual has. So if you remove the profit aspect of it, and it just simply existed to serve a function, then you would have lower costs because you would not have all of this extra money that needs to be made as profit.
Wow.
It's so fucking obvious.
It's so obvious. Profit does extract money from the healthcare services. That is true. Now, whether that leads to any improvements or not, I don't know. It's not even worth arguing about with any audience, including mine. But it wouldn't account for it wouldn't account for the bulk of the extra money that we spend on services. Even if you removed all the profit from the healthcare sector, it wouldn't necessarily fix like the majority. I think more than like 20 or 25% maybe of all healthcare costs in the U.S. But.
So public healthcare? Yeah, absolutely. I think that you should have private healthcare as well. I don't think that it should be illegal to have private healthcare, but people should be able to rely on public healthcare. The people whose lives really get fucked up by healthcare are not the lower class or the upper class, it's the middle class. Because lower class people, and if you're really fucking broke, you just show up to the emergency room. That's what you do. Like, I'm
gonna kill myself. He was partially correct. Middle class people probably get fucked the most because they're on very unfortunate like fiscal cliffs. Like you don't hold on. No, never mind. I'm in a good mood. I'm not banning you. Like working class people or poor people get access to Medicaid. Wealthier people have access to have access to private insurance and shit. And then older people have access to Medicare. But if you're poor, it's that you have access to things like Medicaid or other help. It's not that you can just go to the emergency room over and over and over again. I don't know where this take came from.
But people should be able to rely on public health care. The people whose lives really get fucked up by healthcare are not the lower class or the upper class, it's the middle class. Because lower class people, and if you're really fucking broke, It
was funny that you disagreed when Hassan said the exact same thing. About what?
Just show up to the emergency room. That's what you do. Like, I had to take my mom to the emergency room probably 10 times. Every single time we'd get a bill, you know what we do with the bill? We'd throw it away. And then we go to the emergency room again, and we get another bill. That's it. And it would just keep happening. And so it's not a big deal. And also, we had something called the MAP program. That's what it is here in Texas.
I'm sorry, my mind has been so brain rotted. Doesn't MAP have to do with fucking kids? Am I making this up? What am I thinking of? Am I? That's a real thing? No, I'm sure it's a real thing. Oh, minor attracted person. Didn't conservatives say that liberals or progressives were trying to add pedophiles to LGBTQ with the MAP thing or whatever? But my brain is rotted. I'm sorry. Okay.
That's it. And it would just keep happening. And so it's not a big deal. And also, we had something called the MAP program. That's what it is here in Texas. And if you make under a certain amount of money, you then have your health care paid for by MAP.
There you go.
Which is like it turned your copay from being like my copay for getting dental work done, they like pulled out a tooth, was $10. Literally $10. Like you don't have to pay anything. And I could have also just walked out and not paid it. How's that not?
Destiny, I was pretty against your take on health insurance companies, but then after looking at UHC's profit margins, and they are only 6%, I'm sort of coming around to your way of thinking. It's not like they're adding much fluff to the current system. Good for you. However, if you weren't a fucking retard, okay, like all of you are, what you would say is, Destiny, I know that you like to focus on profit over revenue, but shouldn't we actually look at the entire operating costs of all of the health insurance companies? Because it's not that we're worried about the profit, it's that the administrative load of these companies, period, could be reduced if the healthcare providers themselves could provide the coverage. So we should really be looking at the total expenditures of all of these companies, right? Technically, you could say that, but it doesn't matter.
Not the same as government healthcare? It is. But what I'm saying is that the real squeeze on people comes from people that make too much money to qualify for government assistance, and they make too little money to be able to afford private healthcare without it affecting their budget. Those are the people that are very negatively affected. It's the middle, I'd say like probably 50% of people, probably maybe 70, 80% of people really. So yeah, that's my experience at least.
What does it mean? That's his experience. Or I guess it was a poor and rich person, maybe? I don't know.
A lot of political people said, let it rot and let it be a failure.
Yeah.
I said, that's not the right thing to do. And
somebody says free healthcare in Canada has issues too. What if I told you that we have issues with healthcare here? I used to think Canadian healthcare was really...
Congrats on being born. Thank you.
...really bad until I asked a few people, and then they all told me, like, no, it's fine. I've been there.
Why I hate my life? I'm the problem. It's because I'm autistic. I'm autistic. I have autism. I acknowledge that.
Bad issues with healthcare here.
Okay. You have an opinion about a comprehensive system that impacts the lives of 20, 30, 40 million people? How many people live in Canada? Canada population. 40 million individuals are affected by this massive system. If you wanted to collect comprehensive information about that system and how it compares to the rest of the world, how would you go about doing that?
I used to think Canadian healthcare was really bad until I asked a few people, and then they all told me, like, no, it's fine. I've been there and it's okay. So I think that people having bad interactions is always true, but that's not something that's probably limited to Canada.
Oh, we would just ask a few people. Oh, okay.
And I know that, like, my mom had bad experiences with private healthcare here. Like, that's what happens no matter what.
Very good people in the medical area that handle that. And I said, what do you want to do? He said, we really have an obligation to make it as good as we can. And we did. We made it as good as we can make it. Instead of making it bad where everybody would be calling for its repeal, I made it so that it works. Now,
but you did
works.
try to overturn.
I did dislike the fact that Obamacare necessitated you paying insurance.
Where do you think the money for single payer is going to come from, Asmongold? Why would you say this? He's going to say something to rectify that situation. To this, what did he just say? He's about to change. He's going to say, there's a way, actually. There's a way to salvage that statement. There's a way to salvage that statement. I've looked forward into 1,342 million universes, and in 17 of them, Asmongold's next line is, if we want to have socialized healthcare, then we should just have socialized healthcare, but I'm uncomfortable that the U.S. federal government forces me to pay private companies for insurance. Okay, you're cleared for takeoff, Asmongold. If you say anything besides that, it is the most retarded thing I've ever heard on his stream before.
I thought it was a government overreach. When a person is legally compelled to pay a private company, I think that's disgusting.
Okay, it's not the worst.
Like, just straight up the mandate. Yeah, that's the main reason I didn't like it. Car insurance,
How is this not dumb too? It is kind of dumb, but it's better than, it is what it is.
I think car insurance is slightly different.
Because you don't have a right to drive. Driving is a privilege, but you should have a right to health care.
Because you're using public roads. And so it's like you're basically like paying for the roads and you're affecting other people. And it's also...
What do you think? What do you think do you think the hospitals are built just for you? Like there's one hospital per person? Or what do you think insurance and healthcare coverage like pays for? And when you pay the hospitals and the doctors?
For the other person and not necessarily yourself. Like your car insurance is meant to pay for the other person's damages also. But also like I do have that viewpoint for car insurance as well. But health insurance, I very strongly believe that. And car insurance, I'm not as strongly motivated. Yeah, driving is, that's also a really great point too, is that you don't have to drive, but you do have to
have health insurance or
have health care, right?
You understand, like, not to be an asshole, but like being able to drive is probably more important for most Americans than having access to a hospital, right? It would suck if you got really sick and needed to go to the hospital, but like my guess would be 80% of Americans probably couldn't, like they just wouldn't be able to survive without a car. Like if you, for the percentage of Americans that have like life-ending healthcare situations, that would suck, but way more probably need to drive than need to go to the hospital.
It's
lousy. You did try to overturn it. You did have your justice.
Destiny, not everyone owns a car. Everyone is alive though. You don't need to go to a hospital to be alive. What do you mean? You can't live without health care? What do you... never mind. I'm just banning and moving on. I'm just ban and move on. Okay. I don't think driving outweighs healthcare in a basic right scale. That's great. I'm glad you think that. I don't want to hear it from rich kids, okay? No rich kids. We need to have an income cutoff, okay? We need to have an income cutoff in my chat for saying retarded fucking statements, okay? In the United States of America, you cannot survive without a car. You have to have a car to drive and go to work. Most people are reasonably healthy, such that they're probably okay without doctor's visits. That's how health works. Generally speaking, most people are reasonably healthy.
This department tried to direct the Supreme Court to...
No, we got a little bit of a surprising opinion, to be honest with you. If it would have been overturned, we would have had much...
That's not true. What did I just say that wasn't true? You can't live without health care? That's not what you meant to say, because there are living humans that have never seen the inside of a hospital, believe it or not. I don't even know what that statement meant. Like, what do you think is the percentage of Americans that have like a life-threatening visit to the hospital below the age of like 35, but below the age of like 50? If you get cancer and are looking at death without medication, I think driving would be the least of your worries. How many, do you think the average person has cancer? Why is my audience not even immune to the AIDS around this conversation? Like your brain just shuts off. Do you think the average person has cancer? You need healthcare for any basic treatment. It is impossible to antibiotics or cold meds without healthcare. I know this is going to be a mind fuck to you, but you understand that like you can get over disease, most diseases you can get over without antibiotics or a hospital visit. You do know that, right? I'm not saying it's good to not have healthcare. I'm just saying that to most people, having access to an automobile is more important. Without a car, your life is over. You are done. You can't work. You can't work. You're gonna die. You have to have a car. Destiny, don't be obtuse. Rotten teeth, bad eyesight, all other sorts of stuff. Okay.
Much better health care right now. But right now, we have something that I made the best of. I could have made the worst of it, and it would have fallen by the wayside.
It's disappointing that they tried to make the...
Destiny, does the average citizen live in an area that doesn't have any transit? Most of the population lives in a city, as far as I know, so you could probably get by. Who? Hold on. That's a European. You got to be a European. Hold on. Not European. How? Destiny, the bloat or total operating cost argument could be an interesting one. The argument you'd have to make is that the government could do it more efficiently. The argument I'm making, at the very least from a health insurance perspective, is that the profits being extracted is pretty minimal. Sure, the reason why you can argue that the government could probably administer it more efficiently, but the problem too is that you have to have you have to have more communication allowed between government administrations. But like theoretically, the government is theoretically positioned to have more control or access to information and can administer it more cleanly than having 52 million different people that like collect information about you and have different healthcare records and different whatever, like all sorts of stupid shit. Like theoretically, the government should be able to do that more efficiently, right? Speaking from personal experience, I can work and live life just fine without a car, but I 100% need healthcare. I am blind. Destiny, if you had to choose a right to drive or a right to access to healthcare, which would you choose and why? I'd probably choose healthcare because I'm rich. But if you were to ask me when I was working, obviously driving is the most important thing in the world. It's like not even close. How can you survive without driving? Your life is over. Well, you can't do anything. Your life is over. What happened to millennials getting like mind fucked? It's so funny that like 5 years ago, the millennial meme is GP. I haven't been to a doctor in 15 years. And now every single millennial is getting biannual checkups. You guys are getting colonoscopies and eye exams and dental visits. You guys are doing all of this shit like every 3 months. Holy fuck. What happened? Jesus Christ. Address the bus argument? I'm not going to address the bus argument because if you're living in the United States of America and you're telling me that a person that lives in an average city can rely on the bus to get to and from work, you've just never ridden a bus in the United States before. There are like fucking 4 cities. I'm trying to think of cities I've been in with acceptable public transit. Boston and New York City are the only ones that I can think of. Fuck buses in LA. Fuck all the buses in fucking Omaha. Miami kind of has some, but like you're talking about like hours and hours maybe out of your day, depending upon where you're going and depending on how far out you live. Also, you're also taking into account, these are only people that are living in like the most densest parts of these cities. But like if you live like a commute out, like if you live in, like if you work in Chicago, are you taking a bus from like a suburb like 40 minutes away to work? Is that possible?
The best of it. I think they should totally throw it out and do single payer healthcare. I have like, I'm going to be honest, like
address the sleeping at work argument. What is the sleeping at work argument?
I don't really care what they do until they do that.
I did the right thing from a human standpoint, but you know, I'm sort of proud of my decision. At the same time, sometimes I regret it. I told the people, and I gave them the money to do it. I said, fix it, make it work, because people would have suffered. Mm-hmm. But it's too bad that they voted no. I wish John McCain.
Now, this is an auto insurance website, so maybe their stats are biased. Okay, I don't know. The most common commuting modes. In 2022, 77% of Americans drove, 69% drove alone, 9% carpooled. Public transportation, excluding a taxi, 3%.
I wish he fought for 10 years on replacing Obamacare for 10 years, and then he voted against. Nobody understands it.
Sir, you said during the campaign you had concepts of a plan. Do you have an actual plan at this point for health care?
Probably not.
Yes, we have concepts of a plan that would be better.
Still just concepts? Do you have a fully developed plan?
Let me explain.
No, he doesn't. He doesn't have a full plan.